You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. Today we're going to be talking about steroids. Steroids are a class of medication that a lot of doctors use on a daily basis. Millions of prescriptions are used each year, and they're used for many, many different types of conditions. There are different types of steroids for different types of diseases, and sometimes it causes confusion for patients and their families about steroids. Many people have a stigma, meaning a negative impression of steroids, and that is understandable. But my goal is to really explain some of the different types of steroids, what the harmful ones are, what the beneficial ones are, and some of the questions that you can ask your doctor if you need more information. Now, some of the most common steroids that are naturally produced by the human body include hormones. So estrogen, progesterone, and testosterone are all natural hormones that are actually steroids. So the body needs these. Men and women both produce all of these in different amounts. Babies produce them. Adults produce them. They're necessary for natural development. Now, the steroids that typically people think about are called anabolic steroids. So anabolic steroids are synthetic variations of the male hormone testosterone. These are the ones that people use when they want to build muscle rapidly. So if you have professional wrestlers or professional football players, they're going to the gym, trying to get ripped, trying to get very big muscles. These are the ones that are commonly abused. There's different names for them, including gear, juice, roids, and stackers. And in general, these are illegal. These are not typically prescribed by most doctors, certainly not in the emergency department, but there's a lot of companies that sell them or variations of them because they are all synthetic. So these are not naturally produced in the body. These are actually developed in laboratories and then sold to other people, either online or in person or in other countries, and oftentimes they are misused by athletes, bodybuilders, and other people in that category. Now, anabolic steroids, what they do is a lot of side effects. There's just so many side effects to it, it's unbelievable that people would still keep taking them. They can cause things like paranoia. They can cause extreme jealousy, aggression, which is called roid rage, delusions, where people think other people are spreading rumors and false beliefs about them. It actually impairs judgment. And then it also causes mania. Mania is a type of situation where people don't sleep for days at a time, or they become very, very hyperactive. They're doing 3 or 4 very large projects at the same time, traveling all over, doing things that they typically don't do, all because of the anabolic steroids. Now, it affects the brain, but it also affects the kidneys. It can cause kidney failure, causes liver damage, because a lot of these synthetic forms of steroids have to be metabolized in the liver, and it causes permanent damage. It also raises blood pressure, and it leads to heart problems, causes cholesterol problems. And I've seen many young people, perfectly healthy people in their 20s and 30s, develop a stroke or a heart attack or die simply from using anabolic steroids. So these are not really good medications to be using. There's very, very few indications for them. They're banned in all major sports. People continue to develop them in laboratories and sell them, but truthfully, they're not advisable. And that's why a lot of people in general, patients who actually need steroids, always assume we're talking about anabolic steroids, but that's not the case. I don't prescribe anabolic steroids. No one in my hospital prescribes them, but these are the ones that people will hear about at the gym and so on. Now, the ones that we do commonly use are called corticosteroids. So corticosteroids are a large class of steroids that are beneficial. They are used for many, many different types of diseases and problems. Cortisol is a corticosteroid that's naturally made in the body. Cortisol is made in the adrenal gland. So the adrenal gland lives on the top of the kidney. So kidney is renal, and these are adrenal, meaning they're right above them. So on the left and right kidneys, there'll be a tiny gland that produces cortisol on a daily basis in a low amount, and that helps for maintaining general health and metabolism. When somebody is ill or under significant stress, it increases cortisol. That's a natural temporary response, and then it tapers off and it goes back down to a normal level. So that's how adrenal glands work. They help to keep the steroid balanced naturally. Now, steroids are used for many conditions where the body overreacts. So, for example, in asthma, if you have hives, allergic reactions, or eczema, these are situations where the body is exposed to something. It could be a chemical, it could be an infection, it could be a food allergy, and now the body has developed a severe reaction with swelling, hives, itching, burning, and it could potentially turn into a life-threatening situation. that's when we need steroids. Because the body can't produce enough cortisol to calm it down, we have to give them extra steroids at that moment in order to save their life. So that's usually where we're using steroids in the emergency department. Now, the steroids themselves come in several different dosing strategies. What that means is there's a burst versus a taper. So a burst means you give a high dose of steroid for a few days, maybe 3, 4, 5 days, and then you stop. So that's called a burst. A taper is where you take a high dose the first couple of days, and then you take a medium dose for a few days, and then a low dose for a few days. So you start high, and then every day you decrease it by 1 pill or 2 pills until you're back down to 0. So that's called a steroid taper. Now, a burst of steroid, if it's pills, we use prednisone. That's one of the most common medications. It's cheap, it's effective, and it's easy to dose. A taper is called a Medrol dose pack. So if you ever go to the pharmacy and your doctor gives you a dose pack, there'll actually be a little pyramid. There'll be 6 pills the first day, 5 the second day, 4, 3, 2, 1. It's actually very easy to follow that down. Now, some people have adrenal suppression when they take steroids. So if they have to take a prednisone or a Medrol dose pack for asthma or an allergic reaction, their own body temporarily stops producing steroid, the cortisol. And that's why we have to be very careful. Because if you use steroids over and over and over again, the body won't make its own. And then those people become steroid dependent, which is also not a good situation. Now, there are different categories of steroids. These include inhaled steroids. So you can use Flonase, for example, as a nasal spray. That's used for allergies and sinus and sneezing symptoms. So a lot of people use low-dose inhaled steroids just in the nose, and it calms down their itching and burning. There's inhaled steroid pumps. So these are used for asthma patients, things like Pulmicort. It can be used in a nebulizer, so they can breathe easy. It just works in the lungs, and then it disappears. It doesn't even go out into the bloodstream. There's steroid pills, like we talked about, Medrol and Medrol dose packs. There's prednisone as well. For babies or young children, we have liquids, which include Orapred and prednisolone, also dexamethasone. Dexamethasone is a steroid that's also used for croup and people who have asthma attacks. So if they're children, they need a liquid formulation of that. Steroid injections are also available. These include dexamethasone, and there's other forms of that, triamcinolone. So this is the steroid shot that oftentimes people get when they're in the emergency department. We use it for hives. We also use it for asthma attacks. We also use it in the joints. So if somebody has a knee problem or some swelling in their elbow, they might get a cortisone shot, and this is what they're talking about. Then there's many steroid creams. Over the counter, you can get hydrocortisone, which is a very, very low-dose steroid cream, and that's used for mosquito bites and some mild irritation, eczema, and so on. Then you go up to triamcinolone, which is a medium potency, and then you have high potency, which is betamethasone and some of the newer class of agents. You don't want to use steroid creams long-term, though, because they can actually cause wrinkles. So always be careful if you're using steroids for an extended period of time. Talk to your doctor so you don't get any wrinkles. And then there's even steroid eye drops. So these are called Pred Forte. Steroid eye drops are used when there's an injury to the eye. If there's a scratch on the eye or if someone has some eye irritation, these can be prescribed by your ophthalmologist to calm it down until things improve, and then you can discontinue them at that point. Now, again, we talked about some of the side effects of steroids. So even the prescribed ones that we use in the ER, the ones that your doctor will use for asthma attacks or COPD or emphysema, all of these will have the side effect of raising your blood pressure, raising your blood sugar. They can also cause anxiety or depression in some people. Some people, they can't sleep. They actually develop insomnia if they have to take steroids for a period of time. So they're up at 3 a.m. cleaning their house and they can't sleep for days, but they're breathing much better. And so that's why we have to use them in those situations. And again, it can cause steroid rage, also called roid rage. So these people become very angry and moody. We don't want that to continue long term. So we try to get people off of steroids as soon as possible so that they use them only when they need them, and then we stop them for everything else. There are some conditions where they have to be on them chronically. Those are called autoimmune disorders, things like lupus, rheumatoid arthritis, multiple sclerosis. These are cases where those people really, really need the steroids, unfortunately. And then even cancer. There's a lot of chemotherapy agents that are combined with steroids because they're more effective. So a hematology or oncology specialist, which is a cancer doctor, oftentimes they'll use steroids to help manage their condition. So again, we talked about a lot of different information about steroids. So this is something that our pharmacists help us out with on a daily basis because there's so many out there. But I just wanted you to have some information so that if your doctor prescribes you a steroid, ask them these questions. What are the side effects? How long do I have to take them? What are the benefits? Are there other alternatives? And always keep a track of all your medications, especially the steroids, so that you know how often you're taking them. If you only need them once every few years, I'm not too concerned that you're going to have any side effects. But if you're using them every other month, then potentially you become steroid dependent. So it's something very, very important to talk with your doctor and your family members about. If you have any questions about steroids or some other comments, please send them to us on social media. You can follow us on Instagram and Tumblr. And I hope that you learned a little bit on today's episode. All of this information is on our blog, simplehealthradio.com. And I look forward to having you back again on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.